Most people think stretching fixes muscle pain. It doesn't. If you don't release the trigger point, you're just pulling on a stuck knot. And that's why your pain keeps coming back. I'm Dr. Chris Shiflett, retired Navy SEAL, owner of Trident Elite Healthcare, chiropractor, and functional medicine practitioner. I've seen what chronic pain does to elite performers, and I've treated it without prescriptions, without surgery, and without masking the problem. What I'm about to teach you is the science behind real lasting relief using trigger point therapy. Stick with me because most people, even the ones with degrees, don't understand what I'm about to show you. Here's what we're going to cover in this video. What a trigger point actually is and why it's not just a knot. The science behind how they form, why your nervous system matters more than your muscle, how trigger point release therapy works, what the research says about its effectiveness, what you need to avoid so you don't make it worse, and a little demonstration so you too can experience the benefits. Let's break it down. What is a trigger point really? A trigger point is a hyper-irritable spot in a muscle. It's not just tension. It's a local contraction of muscle fibers inside a larger muscle that stays on when it's supposed to be off. Think of it like a glitch in an electrical signal. The muscle gets stuck in a holding pattern. You'll feel it as a tight band or a knot, painful right at the spot. Other times it sends pain somewhere else entirely. That's called referred pain. Janet Travell, JFK's personal physician, coined the term trigger point back in the 40s. This isn't new, it's just misunderstood. How do they form? Trigger points form when a muscle gets overused, underused, or injured, or left in a bad posture for too long. That means you get them from overtraining, but also from sitting at your desk all day. The theory is that a sustained contraction cuts off local circulation. That leads to a buildup of metabolic waste, acidity, and drop in oxygen. Muscle can't flush the garbage, so it locks up. The information I just explained can be found in the description with a link to the reference. Nervous system control is the real driver. Here's where most people miss the point. Trigger points aren't just local muscle issues. They're part of a dysfunctional feedback loop between your brain, spinal cord, and the muscle. Your brain sends the wrong signal, your body reacts, and the loop keeps running unless we interrupt it. This is why massage alone doesn't always work. You have to change the neurology, not just smash the tissue. How does trigger point release work? There are a few ways. Manual pressure with a thumb or an elbow or a tool. Ischemic compression, where you press and hold until the blood supply temporarily stops and then floods back in. There's the pin and stretch techniques. Dry needling, if you are licensed for it. Even targeted neuromuscular stimulation. But here's what they all have in common. They send a new signal to the brain, they override the old faulty pattern, and you're not just breaking up a knot, you're resetting the circuit. Studies show significant reductions in pain and improved range of motion when trigger points are addressed directly. For example, a 2017 meta-analysis in the Journal of Bodywork and Movement Therapy showed that manual trigger point therapy reduced pain intensity and myofascial pain syndrome. A 2018 study in pain medicine found that dry needling of trigger points in the upper trapezius significantly reduced neck pain and improved function. But the real-world evidence, it's in what patients say. I finally feel like my body isn't fighting me anymore. Here's where people go wrong. They dig too deep, too hard, or too fast, causing more inflammation. They stretch without releasing first. They confuse soreness for progress. They skip hydration, and minerals that help muscle recovery. Worst of all, they do it once and expect a permanent fix. This is not a one and done process. It's a system reset. And like any system, it takes repetition and feedback. Now that we have that science stuff out of the way, let's dive into a demonstration. Okay, so what I have right here are 2 massage balls. This is the type of massage ball I use for trigger point release. It's called Deep Recovery. You can get this from Deep's website, or you can contact us to order as well. I have 2 different size massage balls. We got the smaller one and the bigger one, more like lacrosse size. The smaller one, more like tennis ball size. And the reason for the 2 different sizes, obviously, or maybe not so obvious, is different muscle groups. Some areas are harder to reach, and so the smaller ball can get into places that the big ball can't. The big ball reduces the amount of time by hitting large muscle groups like the glute or the pec, things like that. Okay, so as I said before, the purpose of trigger point is to reset that loop. And so with this type of trigger point release, we're gonna use the ischemic compression technique. So just like how I would press, and you can see the blood leaving my hand and then it starts to come back in. It's that same concept. Now the reason for that is because some of the properties like calcium and sodium ion channels, things like that, are needed in order for a muscle to sustain contraction. So when you apply ischemic pressure, you break up that loop a little bit and maybe enough to allow the muscle to relax. So what I'm gonna show you is a technique of 30-second hold max with a 30-second break, and doing that up to 3 times. But imagine that trigger point, these are your muscle fibers, they've bound up and twisted on each other, okay? So then you have that spot that you feel in your neck or in your back or wherever. So what we're gonna do is I'm gonna show you just on the trap area. We see a lot of patients for neck pain, and a lot of times there's trigger points in the SCM, scalenes, upper trapezius, things like that. So I'm gonna show you an example of how to use the big ball for the neck, as well as how to use the small ball to get right in behind here, just behind the scapula, on those rhomboid muscles. That's a little bit harder to get pinpoint with the bigger ball. I like to use the wall here, and the reason for that is because it gives me a little bit more mobility. I can move around the wall easier than if I was trying to lay down on the ground and do this. So let's say, for example, I have a spot right here in my neck, okay? I would use the big ball against the wall. The reason being is because it gives me some standoff from the wall and allows me to get into that spot. So all I'm gonna do is hold on to the ball while I find the spot. So I'm gonna roll around until I find that spot that's just like, really irritating and painful, to be quite honest. Then what I'm gonna try to do, as much as I can stand, I'm gonna press into that spot, okay? Now I have a timer on my watch. You can use your phone or whatever, but you're just simply gonna time that 30 seconds. What you wanna feel is one of 2 sensations. One sensation, and the best sensation that you could possibly feel, is you literally feel that tense muscle just relax and flatten out and go smooth. That is beautiful. That is the best sensation you can possibly feel. But let's be honest, that's not always gonna happen. Remember, this is a process. So if that doesn't happen, the other sensation that you wanna feel is that muscle, it goes from really painful, really bothersome to, that's not so bad. Okay, So if you've accomplished that in the first 30 seconds, you're done. If you haven't accomplished either of those two sensations in the first 30 seconds, you're gonna relax. The reason for relaxing and not continuing to hold is because your body's very smart. And so what will start to happen is it recognizes the ischemic compression and it will vasodilate and start forcing blood back into the tissues. If the blood starts rushing back in the tissues in that manner when you're not trying to, you could cause a harder contraction. So 30-second hold, relax. If you've waited another 30 seconds, you didn't get the sensation you were trying to feel, you can do another 30 seconds. So you can do that up to 3 times. If you don't accomplish some level of relief, now remember, let's just use a 1 to 10 scale, and let's use 10 as the most painful. If you press into that spot and it's a 10 and you get it to a 6, that is good. You're not gonna necessarily get it to a 0 or a 1, okay? So consistency is the key, and remember it's a process. Don't try to completely eliminate it all in one setting. Okay, so that was with the big ball. Now let's use the smaller ball here. So this one I'm gonna use because I get a lot of patients that get this pain right here behind the scapula, kind of going down the mid-thoracic spine there. The big ball is so big, it covers too much area and can't be very particular with it. So what I'm gonna do, I'm gonna put the ball on that spot. I'm gonna bend my knees a little bit, lean back into the wall. So now my feet are pushed out away from the wall a little bit, and I'm leaning, I'm rolling, and I'm trying to find that spot. And once I've found it, I can use the other wall for support, and I'm just gonna push into it as hard as I can. Again, 30-second hold. I'm feeling for that sensation of the muscle to relax or for the pain to drop down a little bit. So maybe it's an 8 and goes to a 6, or a 6 and goes to a 4. Whatever it is, you're looking for that pain to decrease a little bit within 30 seconds. If it doesn't, relax, wait 30 seconds, try it again, up to 3 times. Okay, so that's trigger point release demonstration using the deep recovery balls. Again, you can search those. I have the link in the description. I'm not affiliated. I don't get any money or anything like that. Just providing you information and what we use in our office and what we give to our patients to help with their muscle pain issues. All right, now that you understand the science, don't stop here. In my next video, you'll discover the other aspect of releasing muscle tension and fascia. I'll walk you through a 10-minute foam rolling routine that targets fascia across your body. You'll see how to do it right, and more importantly, how not to waste your time doing it wrong. So what are you waiting for? Click the video here, and let's start resetting your system.